Pregnancy and why you may expect a cesarean section. Pregnancy is often described as a miracle, a journey filled with hope, excitement, and dreams of holding that tiny new life in your arms. For many women, the picture of labor ends with natural birth, tears of joy, and a first cry echoing through the room. But sometimes, reality takes a different turn. The doctor's words echo in your ears. We may have to go for a cesarean section. In that moment, questions flood the mind. Why me? Did I do something wrong? Is my baby safe? The suspense can be overwhelming. But here's the truth. A cesarean section isn't a failure. It's a life-saving option for both mother and child. Let's unravel this together, with compassion, clarity, and courage. What is a cesarean section? A cesarean section, C-section, is a surgical procedure where a baby is delivered through an incision in the mother's abdomen and uterus. It can be planned in advance, elective, or decided during labor, emergency. A cesarean section, C-section, is a surgical procedure to deliver a baby through incisions in the abdomen and uterus, often scheduled when vaginal birth is risky or complex. Why might a pregnant woman expect a C-section? 1. Complications with the baby's position, breech presentation. Baby coming with feet or buttocks first, or transverse lie. 2. Obstructed or prolonged labor, when labor is not progressing, despite effort and medical support. 3. Fetal distress, when the baby shows signs of struggling inside the womb. 4. Multiple pregnancy, twins, triplets, or more may require C-section for safety. 5. Placenta problems, such as placenta previa, placenta covering the cervix, or placenta abruption, placenta detaching early. 6. Previous C-section or uterine surgery. Sometimes vaginal birth may pose risks of uterine rupture. 7. Maternal health issues, such as severe preeclampsia, heart conditions, infections, like active genital herpes, or uncontrolled diabetes. 8. Baby size versus mother's pelvis. Cephalopelvic disproportion, when the baby is too large to pass through safely. 9. Umbilical cord emergencies, cord prolapse or tight cord, entanglement around the baby's neck. Common reasons for a C-section include breech or transverse positions, placenta previa, placenta covering the cervix, multiple births, certain fetal conditions, and risks from the mother's health or previous uterine surgery. While some C-sections are planned, many unplanned emergencies during labor due to complications, like stalled labor or a non-reassuring fetal heart rate. How is it diagnosed or decided? Doctors decide on a C-section based on antenatal scans, tests, and clinical assessments during pregnancy, ongoing monitoring during labor, fetal heart rate, contractions, and mother's vital signs. Emergency complications that arise unexpectedly. Can C-sections be prevented? Not all can be prevented, but some factors reduce the likelihood. Regular antenatal checkups for early detection of risks. Good nutrition and weight management during pregnancy. Controlled blood sugar and blood pressure. Proper planning with healthcare providers. If you've had previous surgeries or complications. What to do if you're considering a C-section. Talk to your doctor. Discuss your pregnancy with your healthcare provider too. Understand your risks and their reasons why a C-section might be recommended. Review your health history. Be sure to inform your doctor of any previous uterine surgeries or significant medical conditions. Consider VBAC if you've had a prior C-section. Ask your doctor about the possibility and safety of a vaginal birth after C-section, VBAC. Treatment, management, and supportive care. Before the C-section, the medical team explains the need, obtains consent, and prepares you. You'll receive anesthesia, usually spinal or epidural. During the procedure, a sterile incision is made, and within minutes, your baby is safely delivered. The team ensures both you and the baby are stable. After the surgery, supportive care, pain relief and wound care, gentle mobilization to prevent blood clots. Support for breastfeeding. Yes, you can breastfeed after a C-section. Emotional reassurance, because healing is not just physical, but also mental and emotional. A cesarean section is not a weakness. It does not mean you failed as a mother. In fact, it's proof of your courage and your body's resilience. The ultimate goal is not the mode of delivery, but the safe arrival of your baby and the preservation of your health. Pregnancy is unpredictable. Every journey is unique. C-sections are often life-saving, not optional luxuries. Early antenatal care helps anticipate and prepare for risks. Support from family, health workers, and community makes recovery faster and easier. If you are pregnant, planning to be, or supporting someone who is, remember this. The story of birth is not about how the baby arrives, but about the love and life that begins. Stay informed. Cherish the journey. Trust the process. And if you found this message valuable, let's spread hope and knowledge together. Like this video, share it with someone expecting, and subscribe for more honest conversations about health and life. Your engagement might just save a life.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.